Welcome back. Last week we talked about the mid-back and some of the muscles that go along the spine to provide us movement for our spine. Sometimes it's not just muscular where we have pain, but inside deeper in the joints. And that can be if there are certain muscles in your spine that are pulling on your vertebrae, which are stacked up on top of each other, and pulls them just slightly out of position. If they go slightly out of position, you can get sharper pain or even pain that radiates around your side or even down your arm. And it can come from various levels of your spinous processes. What happens in those situations is there is impingement. So muscles have pulled on the bones and pulled them slightly out of position. Sometimes that can lead to a pinching of a disc. And so you'll have like a pinched or herniated disc where the disc bulges out and then bones are pushing on it and it pinches it, and that can cause pain. Sometimes where the nerve out of your spine comes out, if bones are pulled and the space narrows, that can lead to pinching or a pinched nerve, and you'll hear that as well. When you have a pinched nerve, you often get pain down the arm, numbness or tingling down the arm, and that's usually higher up in your neck. But sometimes you can get a pinched nerve in your other places in your spine, and it may radiate to the side or even down your leg if it's in your lower back and lumbar spine. So what can you do about some of the spinal issues? One is working on your body position, and that body position means trying to get your trunk and your rib cage in neutral so that there is not extra stress and tension of your muscles pulling on your spine. Our vertebrae are supposed to be able to slide forward and back and twist, but if you're in a posture or position where you're extremely straight and you're trying to decrease these curvatures that we talked about last week, then when you go to move and bend, your vertebrae are being held in place because these muscles are so tight. But if we learn how to change our posture, we can learn how to bend, we can learn how to bend and twist, we can go sideways, and our vertebrae are allowed to move because the muscles are not holding them rigid when we try to do a body movement. So I focus a lot on muscles because they're very important to helping our bones move. Spine issues can come from muscles pulling on them abnormally, especially over a long period of time when stresses in our life add to muscle tension, and then another stressor pulls on it more and pulls on it more, and it just continues to work up. So we have to work on learning how to relax and calm our body down so those muscles release, so the joints can go back into position that allows them to bend forward, go backwards, go sideways, and even twist. This can help you with a lot of mid-back pain when you or anyone else you know, if you see them trying to straighten up too much, give yourself a break, allow things to relax down into position, and see if you can move better. Often it takes practice of a lot of hours over a course of days of practice to get your body to calm down enough to see a difference. When it comes to the spine, especially the mid-back and the low back, it takes more practice than one session of learning how to change the way your muscles are pulling so you don't hurt yourself when you go to try these movements. If you have any questions on this, please holler out at me at paberinstitute.com. Click on the contact me section and send me an email. I'd love to chat with you and even help you out in a personal session if you need it. Thanks. Bye.